Good day everyone. So today I will be discussing you about the parasite called Cyclospora Cayetanensis. Countries in Central and South America have reported significant numbers of Cyclospora infections. This includes countries like Peru, Brazil, Guatemala, and Mexico. And in countries in Southeast Asia such as India, Thailand, Indonesia, and Philippines also experience a notable burden of Cyclospora infection. Various countries across Africa reported cases of Cyclospora infection, particularly in the regions with poor sanitation and limited access to clean water. Cyclospora infection is also reported in the United States, particularly in the summer months. The foodborne outbreaks have been linked to various types of fresh produce, including raspberries, basil, cilantro, snow peas, mesclun, romaine lettuce, contaminated water, no commercially frozen and canned goods produced have been connected to Cyclospora infections. Cyclospora cayetanensis oocysts, or the infective stage, are typically spherical to ellipsoidal in shape and measure about 8 to 10 micrometers in diameter. The oocysts have a thick doubled layer wall that protects them from environmental conditions and allow them to survive outside the host. Then inside the oocyst are two sporocytes, each containing two sporozoites. These sporozoites are the infective form of parasite. The fresh Cyclospora oocyst may appear colorless or slightly blue when viewed under a microscope, and they do not have distinct coloration without staining. The life cycle begins when a person ingests Cyclospora oocyst, often through contaminated food or water. Once ingested, the oocysts reach the small intestine where they undergo excistation. It is a process in which a thick wall of oocysts break open, releasing the sporozoites. The release of sporozoites invade the epithelial cells lining the small intestine. Inside the cells, the sporozoites undergo a sexual multiplication called schizogony to form merozoites. The merozoites further develop into meronts, which are larger structures containing multiple nuclei. The meronts then divide into numerous merozoites. Some of the merozoites are released from the host cells, potentially leading to further invasion of other intestinal cells and repeating the cycle. Additionally, in the environment or within the host intestine, sexual reproduction may occur, leading to the production of new oocysts. Eventually, oocysts are formed within the host intestinal epithelial cells. These oocysts are shed into environment through feces of the infected individual. In the external environment, the oocysts purulate, become infective. This process can take days to weeks depending on environmental conditions such as temperature and humidity. And when contaminated water or food, particularly fresh produce, is consumed by another person, the cycle can repeat, leading to new infections. For diagnosis, we have the laboratory testing. The definitive diagnosis of cyclosporiasis is made by identifying the parasite, Cyclospora cayetanensis, in stool samples. This is typically done through microscopic examination of stool samples for the presence of oocysts or the infective stage of the parasites. Then next we have the clinical evaluation, because the patient usually present with symptoms such as watery diarrhea, abdominal cramping, nausea and vomiting, fatigue, and sometimes fever. It's important for the healthcare provider to take a thorough medical history, including the recent travel, as cyclosporiasis is often associated with travel to tropical or subtropical regions. Then we also have molecular testing. In addition to microscopic examination, molecular methods such as polymerase chain reaction or the PCR may be used to detect genetic material of Cyclospora cayetanensis in stool samples. And lastly, we have the epidemiological investigation. In outbreak situations, epidemiological investigations may be conducted to identify common sources of infection, such as contaminated food or water. This can involve interviewing affected individuals about their recent consumption history and tracing back the origin suspected food items. So, the immune response of a person affected with cyclosporiasis is the initial response of cyclospora infection involves the innate immune system, which provide immediate non-specific defense mechanism against pathogens. These cells recognize the presence of the parasite and initiate inflammatory response to limit the infection. Up next is the inflammation. Invasion of the intestinal epithelial cells by Cyclospora triggers an inflammatory response, characterized by the release of cytokines and chemokines. Signaling molecules attract additional immune cells to the site of infection and help to coordinate the immune response. Next is the adaptive immune response. The adaptive immune response is the body's specific defense mechanism against pathogens. During cyclospora infection, antigen-presenting cells such as dendritic cells present parasites antigens to T lymphocytes or T cells in the lymph nodes. This activates T cells, leading to the differentiation of helper T cells into virus subsets including Th1 and Th2 cells. The antibiotic for cyclosporiasis is the trimethoprim sulfametazole. In addition to antibiotics, supportive care may be necessary to manage symptoms such as diarrhea, dehydration, and electrolyte imbalances. And patients may be advised to drink plenty of fluids to stay hydrated and may require oral rehydration solutions or intravenous fluids in severe cases. So, for the prevention of cyclosporiasis, the first one is to practice good hygiene. Wash hands with soap and water frequently, especially before eating, after using the restroom, and after handling raw meats, fruits, and vegetables, because proper hygiene can help prevent the spread of parasites. Next is to wash your vegetables and raw meats thoroughly, especially those that are eaten raw under running water before consuming them. Next is to practice safe food handling. Follow safe food handling practices including proper storage, cooking, and refrigeration of food items. And be cautious when traveling. To regions where cyclosporiasis is endemic or outbreaks have occurred, avoid consuming untreated water, raw fruits and vegetables, and other potentially contaminated food items. And lastly is to educate yourself. Stay informed about the cyclosporiasis and other foodborne illnesses, and educate yourself and others about preventive measures to reduce the risk of infection. By following these preventive measures, individuals can reduce the risk of contracting cyclosporiasis and other foodborne illnesses associated with contaminated food and water. That's all. Thank you for watching.